We need all these PPE as well as safety glasses or goggles, and keep in mind regular exam gloves and isolation gowns are not appropriate for reprocessing. This is an example of reusable semi-critical equipment that has come in contact with non-intact skin or mucous membranes. Make it sure you have proper ventilation in the room for additional safety measures. Pre-clean the instrument to remove any organic contents to discard in proper container. All medical equipment must be cleaned first, using water and detergents prior to any subsequent disinfection or sterilization. Using enzymatic solutions like Medzyme as a detergent, please adhere to manufacturer's instructions for preparing solutions and use measuring devices or methods to ensure consistent concentrations. Immersible devices with heavy or difficult to remove soil should be soaked before cleaning. Soaking is used to prevent soil drying on the device. Soaking is also used to soften residue to make devices easier to clean. You can use brushes, reusable or disposable, or cloths for physical cleaning. Disposable brushes are recommended. Reusable cleaning brushes must be sterilized or high-level disinfected between uses. Cleaning may be done manually, using detergent or enzymatic solution, water, and friction, or mechanically in an automated washer decontaminator disinfector. All manual cleaning must be done under the surface of the water to minimize splashing and aerosolization of contaminated water. Then, rinse the equipment. Make it sure detergents or enzymatic cleaning solutions are discarded following each use. Semi-critical medical devices require a minimum of high-level disinfection. The disinfectant has a drug identification number from Health Canada. Glutaraldehyde is prepared and used according to the manufacturer's instruction specified on the label, MSDS, or accompanying product literature. An appropriate chemical test strip specified by the disinfectant manufacturer is purchased and used to test disinfectant minimum effective concentration at least daily. All logs and documentation forms should be recorded. Devices are completely immersed in glutaraldehyde solutions for the recommended time, and then rinse the equipment. Dry the utensils with a clean, lint-free, soft absorbent towel and move to storage of clean area. Disinfect counter space and sink. Dispose of equipment used, doff PPE, and wash your hands. Do not use the reprocessed sink for hand hygiene. The use of a dual-purpose area requires that all surfaces are cleaned and disinfected twice, once immediately before and again immediately following the decontamination of instruments. Before wrapping an instrument for sterilization, make sure that it had been sanitized, rinsed, and dried. Inspect all instruments for cleanliness and function. Select two wraps of adequate size in which to wrap the instruments. Place the two squares of wrapping material at an angle in front of you on the dry surface with one corner pointing directly towards you. Place the sanitized instrument or articles to be placed in the autoclave just below the center of the wrap. Open the instruments with hinges as wide as possible. Place a 2x2 gauze pad in the opening. 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 Place a 2x2 gauze pad in the ope If the instrument is a sharp instrument, cover the tip with some form of tip protector to ensure safety. Place one sterilization indicator with the instrument. Bring the corner of the wrap closest to you up and over the article towards the center. Then fold it back towards you until it reaches the fold edge, creating a fan fold effect. Smooth the edge of the fold. Repeat the process for first one side and then the other. Finish by folding the package so that the top portion of the wrapping fully covers the package. If necessary, fold the corner back up over itself to create a flat bottom edge. Then, double wrap the now packaged instrument in the same manner as before using a second piece of wrapping. Then tape the exposed point using the autoclave tape. Label the tape with type of instruments, the date, and your initials. Alternatively, autoclave envelopes may be used. Include an indicator strip if the envelope did not have a built-in. Then label the envelope with type of instruments, the date, and your initials.